So, my name's Thalia and I have Dane with me today. So Dane has called the ambulance because he has had a nosebleed that's lasted for about 30 minutes. So we've taken a set of vitals and all his vital signs are normal. There's nothing indicating serious blood loss or possible shock. So the first thing I'm going to do is, Dane, at the moment, you're not pinching your nose at all. No. So what I'm going to get you to do is, if you look at me, I want you to pinch this part of your nose, the fleshy bit just above your nostril. So if you can pinch that hard for me, and I just want to have a look in your, so just keep your head tilted. I'm just going to have a look at your nose so we can see which nostril's bleeding. If you can just remove this. Cool, so we can see that both nostrils are bleeding. So Dane, I'm going to make sure you're just compress a little bit harder. So I'm going to make sure you have your head tilted forward and compress that those nostrils for the next 15 minutes, okay, at least. And in 15 minutes, if the bleeding hasn't ceased, I'm going to look at administering some intranasal adrenaline, which just involves putting some medicine up both your nostrils, alright? If that sounds good?
Cool.
Cool. Dane, are you taking any anticoagulant medication?
Nah.
No? Okay. And do you get these nosebleeds at all, or is this the first time?
No, I get nosebleeds, but they usually stop on your own.
Okay, so this has just lasted a little bit longer than usual?
Yeah.
Okay, cool. So it's been 15 minutes, and Dane, can you just pull the cloth away from your nose a bit? Yep, okay, so put that back now. So it's still bleeding after 15 minutes, so now we're going to move on to some intranasal adrenaline. So I'm going to be giving 0.2 mgs into each nostril. And I'm going to draw it up, diluting it with 9 mils of saline, so that I have 1 meg of adrenaline in 10 mils. I'll just get you to drug check that for me.
Sodium chloride expires January 2020.
And that please.
Adrenaline 1000 expiring 2020.
So that's all in date. So now I'm going to draw the adrenaline up into the 10 mils syringe. Sharps out. I'm going to add a medication sticker added and make sure that everyone knows. So the next thing I'm going to do is I'm going to draw up 2 mils into a smaller syringe. So drawing up 2 mils and ensure that I've got 2 mgs in this. And I'm going to add a medication stick added to this as well. So I'm going to attach the autonomizer onto this. Like so. And then I'm going to use force to, there's quite a lot of force to spray this into his nose first. I'm just going to prime it a bit to make sure there's no dead air. Okay, Dane, so we're going to put one of these in each nostril, alright?
Yeah.
And firstly, I'm going to get you to blow all the clots out of your nose into this towel here.
Okay.
And just clear the nostrils. And then when I start putting the medicine in your nose, I want you to sniff as well, okay?
Yep.
Cool, so if you could blow all those clots out for me. Okay, so
good?
we're going to put this in now. I want you to breathe at the same time. Ready?
Okay.
3, 2, 1.
Yep.
Cool, and we're going to repeat that in the next nostril as well.
Yep. I'll just put this out.
Yep.
Yep.
Okay, So now I want you to compress your nostril right in the same place again and continue leading forward, and you'll compress your nostril for 15 more minutes.
Yep.
And then we'll reassess. If this doesn't work after 15 minutes, I can give a second dose of adrenaline, another 0.2 mg per nostril. Yeah, and then we're going to go from there. I'm going to retake a set of vitals in the next 15 minutes, in the next sort of 5 minutes, to make sure that he's remained hemodynamically stable, although I suspect he will, because it doesn't look like there's been a significant amount of blood loss. Cool, so it's been 15 minutes now, Dane. Can I get you to take the cloth away from your nose and... Cool, it looks like the bleeding has stopped. Yeah, so the first dose of IE and adrenaline has worked. So Dane, what I want you to do now is avoid blowing or picking your nose for pretty much as long as you can. I also want you to avoid having hot showers, hot drinks. Don't do any forceful sniffing anymore. So because the medicine has worked and your nose has stopped bleeding, there's no need for you to come to hospital or see a doctor today. What I will do is write you up some paperwork, leave that with you so that you can sort of have a record of what we've done today. If the bleeding in your nose was to continue, we would try a second dose, and if that were to work, we would take you up to hospital. Because you're not on any blood thinning medication, there's no real need for you to go to hospital or see a doctor today.
Cool.
Does everything sound good to you? Are you happy with all of that?
Yeah, I think so. Yeah. So
cool.
Just with the information.
Yeah.
So I'm assessing Thalia here for lower back pain. She's been at the gym and she's come home and she's called the ambulance. She's complaining of her lumbar pain. So first of all, we're just going to gain a good history. So Thalia, can you just tell me why you've called today?
I was deadlifting at the gym and then I just felt this pain in my lower back.
Felt pain.
And I came home and just thought I'd call you guys to make sure I'm alright.
Okay, and so is that pain, was it after the gym or did you notice it before the gym?
I noticed it at the gym.
At the gym, okay. Was there anything new that you did today that you don't usually do?
Nah, but I think I might have done something wrong.
Okay, cool. Is that pain, so is it a sharp pain or is it a dull pain?
It's kind of achy.
Kind of achy? And does it radiate or?
Nah, it's just in my back.
Okay, cool. So could you just point out on me whereabouts the pain is?
It's here.
Around this? Okay,
So
cool.
it's here.
So she has indicated that it is the lower lumbar area. So with that pain, do you have any history of back pain?
No.
No, not at all. Are you on any medications?
No.
No? Okay. And so how long was it ago since you were at the gym?
4 hours.
4 hours ago. Okay, cool. And have you taken any medication for it?
No.
No. Have you been sitting?
Yeah, I just came home and sat down. It hurts to lie down.
It hurts to lie down. Have you been moving at all?
Not really. I've just been sitting down.
Okay, cool. So I'll just, while you're sitting there, I'm just going to check. Is it okay if I just touch your feet?
Yeah.
Cool. So I'm just going to check the temperature and make sure that they're equal. They're both equally warm. Is it right if I just, I'm going to run this up along the side of your legs?
Yep.
I'm just going to check the sensation. Cool. So you feel that okay?
Yeah.
Yeah. No worries. It doesn't feel any other than usual.
No.
Along here.
It's alright.
Feel all that?
Yeah.
Fantastic. Cool. How does that feel? No worries. Okay, cool. So what I would like to do is, if you could just stand up for me. Okay, so I'm noticing that the patient is sort of splinting her back. And what I would like you to do is if you could walk over to this chair and back for me, that'd be really cool. Okay. So it looks like there's a little bit of a limp, possibly. How does it feel when you're walking to
It hurts a little bit.
It does?
Yeah, I can walk, but it just hurts a little.
Okay, so if you could just remain standing for me, that would be cool. So at the moment I'm just noticing her body type. She's not obese or anything like that. She's a little fit looking. Yeah, so what I want you to do is, if you can take a seat now for me. How's that do?
Yeah, it's alright, it hurts.
It does, okay, cool. So if you could move could you lift your legs? How does it feel when you lift your legs?
It hurts a bit on this side.
It does? Okay, so if you've got good extension there. If you could lift your big toes for me. Working alright? Yeah. cool. And if you could roll your ankles around, how does that feel? Cool. Okay, and if you could just put your feet back down towards the bed. Okay, so she's got extension there. Yeah, so what we'll do next is if you could lie down for me.
On my back?
On your back, yeah, that'd be great. Awesome. And do you usually sleep on your back?
No, I sleep on my side.
Sleep on your side? What side do you usually sleep on?
This side. My left
On
side.
the left side, okay, and the pain's on the right side.
Yeah.
Alright, cool. So what we'll do now, if that's okay, is I just want to palpate your belly. I just want to expose your abdomen as well to make sure there's nothing abnormal looking. Okay, so if you lift your top corner, that'd be cool. Work it. Alright, so on inspection, I can't see bruising. There's no obvious deformities or at this stage. So I'm just going to palpate. Is it okay with you? Which is just pressing on your belly? Cool. So I'm just going to start pressing firmly, just trying to feel for any abnormalities or hardness. So it doesn't feel hard at all, is it sore? No. Cool. Just check the hernias.
No.
No. Not sore. Cool. Sore at all?
No, it's alright.
Again?
No, it's alright.
Alright, so it looks alright at this stage. What we might do, if it's possible, is get you to go on your back.
Yep.
And again, if you can I'll just lift your top.
Mm-hmm.
Awesome. So we're just going to do the same thing again. Expose the area. There's no obvious deformities or discoloration. I'm just going to press slightly. Is it sore, Thalia? No. Sore?
No.
No. Okay. It's a bit sore there? Okay. Go around here. No? Alright, cool. And we're just going to check the spine as well, so I'm just going to apply a little bit of pressure. How does that feel? Is it bad? Any pain?
No.
How about in your neck?
No.
No? It's okay? Alright, cool. Awesome. Alright, so if you want to roll it back over for me, you can do that. So, is there any pain in your knees, your legs, ankles?
No.
We've ruled that out, we've ruled out any pain around the kidneys in that area, and the front, there's no pain.
No.
At this stage, I think, and you've got good circulation, there doesn't seem to be any neurological deficit. You haven't taken any pain relief, so I would like to give you some paracetamol and ibuprofen. Do you have any allergies that we should be aware of?
No.
Nothing like that? Okay, cool. So we'll do that. There's no spine. So I'm just going to go with 1 gram. So it's paracetamol. Haven't had it in the last 4 hours, eh?
No.
Cool. And it's approved on time. You heard of tramadol at all?
Yeah, I've had it before.
You've had it before?
Yeah.
Okay, so we'll also give you a bit of that. So it'll just take off the pain for a bit longer. It's a bit better. Cool. Great. So if you swallow those, what I want to do is I don't think you need to come to hospital straight away. I think I've ruled out skeletal, but I think it could be muscular. You've been at the gym, you're fit, there's no history of cough, cold or anything like that. You don't have any relevant medical history or back pain history. So what I'll do is I just want to run through my red flags quickly to eliminate anything. So there's been no loss of bladder control?
No.
No? Have you noticed any changes in your bladder, urine,
No.
poos? No? Okay, cool. You've taken some vitals earlier and you don't have a temperature. So have you noticed any shivering at all? No sweating?
No.
No. Okay, and there's no abnormal vital signs. Pain isn't in the thoracic spine, it's in the lower lumbar, or it's not in the chest. There's no abdominal pain or tenderness. There's no altered sensation in the saddle area. Altered sensation in both legs, so there's no loss of sensation at all. She's able to walk, which we've witnessed, and there's no general signs of illness, and there's no pain radiating down her legs from what we know. She doesn't have a history of cancer. I just want to go through the orange flags just to rule anything out as well. And she's not sick, so there's no worsening pain. Does it get worse when you're lying down? Or
Yeah.
it does a little bit?
Worse when I'm lying down.
Okay, and at night time, we don't know yet because it hasn't been night, but yeah. And there's no unexplained weight loss?
No.
No. Gone through sensation. It's not radiating down one leg, which we've already come across. She hasn't got osteoporosis, I'm sure, and she doesn't use drugs. So what I'd like to do, Thalia, is I'm going to give you this wee leaflet here, and it'll just explain the back pain, what causes it, and what you can do. And I also would like to write out a POAC. So what it means is that you can go and see your GP because the pain is quite sore. He might be able to help you with some more pain relief.
Yeah.
And so the POAC, you'll be able to, as long as you see him within the 4 hours, it's absolutely free.
Also have to see him within 4 hours when you write it.
For it to be free, yeah.
Okay.
So I'll write that out in a minute.
Yeah.
And yeah, obviously if it doesn't get any better, then give us a call back or go back to the GP. Cheers.
Cheers.